For 13 years, there have been no new drugs approved by the FDA for the treatment of obesity. On June 27, 2012, the FDA finally approved lorcaserin after reviewing years of studies on safety and efficacy. We asked obesity expert Dr. Richard Finegold what he thought of this development. Dr. Finegold, what can you tell us about this new drug?
Well, Joel, it's not yet available to prescribe. It just received approval. We do know that it's going to be called Belviq.
Does it work?
Yeah, in the study, the people who took it lost about 3 times more weight than the people who were taking the placebo. Both groups of patients were on the same diet and the same exercise plan.
Is it safe? A lot of other diet drugs have had serious side effects.
Yeah, it's because of some of the problems with some of the other drugs that this drug was actually held up for so long. What this drug actually does is it increases levels of a chemical called serotonin in the appetite centers of the brain. Now, there have been some other drugs available previously that did that as well. The most famous of them is one called fenfluramine. Fenfluramine was the second fen in fen-phen. The first fen in fen-phen, which is called phentermine, is still available, and we still use it to help people lose weight. Phentermine raises levels of another chemical called norepinephrine. So this new drug, Belviq, or lorcaserin as the generic name is, increases levels of serotonin in the neurotransmitters, just like that other drug, fenfluramine, did. Now, fenfluramine was pulled off the market because people developed heart valve problems with it. About 80 people out of, we think, 5 million that took fen-phen developed a heart valve problem. Because of that, the FDA made the manufacturers of Belviq do a lot of heart valve studies on patients. So people were in the study for 2 years. They were receiving echocardiograms of their heart every 3 months. The rate of heart valve problems was the same for people taking Belviq as it was for placebo. So they think it's very safe for that. The other side effects were fairly minor. People got some headaches. Those would go away if they stopped the drug. Nothing serious. And for some reason, people were more likely to get an upper respiratory infection, a cold, if they took Belviq.
What other side effects does it have?
The other side effects were fairly minor. People got some headaches. Those would go away if they stopped the drug. Nothing serious. And for some reason, people were more likely to get an upper respiratory infection, a cold, if they took Belviq.
Will you be prescribing this drug?
Yeah, I will. I think that the safety issues have been pretty laid to rest. I am a little concerned that there was not a study done with people taking both phentermine and Belviq at the same time.
Why are you concerned about that?
Well, the problems with fenfluramine didn't really surface until it was combined with phentermine to form fen-phen. Now we think about, as I said before, we think about 5 million people took fen-phen, the combination of phentermine and fenfluramine. So in this study with Belviq, they did not try to combine it with phentermine, but we know in real life that's probably going to happen. We know that there might be some doctors that might try to prescribe both of them at the same time. We know that there will be patients who will want to be on both drugs at the same time, who may even see different doctors and not tell each doctor what they're getting. So it'd be nice to know what the effect would be of taking both of those at the same time. And because we don't know what that is, I will not be prescribing the two of them simultaneously.
Is Belviq right for every patient?
Well, just like any other weight loss medicine, no, it's not right for every patient. There are potentially interactions with some other medications that patients may be taking, and there's a lot of other medications that we have to offer patients, besides good old diet and exercise as well. So the best thing I can tell patients is to seek a consultation from somebody who's expert in weight loss and see if this drug is appropriate for them. Okay, Jill, you're doing really well on your weight loss plan. Do you have any more questions for me before we finish today?
No. Oh, wait, I did have one. Um, there's a new weight loss drug on the market called Qsymia. Is that something that could be prescribed for me?
Yeah, I'm going to ask you one question first. Are you contemplating getting pregnant soon?
I have no plans for that.
Okay, I'll tell you why I asked that in a second. Yeah, Qsymia is a combination of 2 medicines that have been available before. I've actually prescribed both medicines independently to patients for many years. I feel very comfortable using them. The first medicine is called phentermine. Phentermine is an appetite suppressant. It raises levels of adrenaline, in the appetite centers of the brain. When that happens, then people feel full faster, and they tend to be looking for food less between meals. The second drug in there is called topiramate or Topamax. Topamax is first approved in children for certain kind of seizures that children are prone to. So it's pretty safe. You can see if it's, if that's the first group that it was approved in. The other big use for topiramate has been for migraine suppression. So people who get a lot of migraines, if they take Topamax, in general get less migraines. Okay? Mm-hmm. Now, topiramate's interesting in that it causes weight loss as a side effect. Most medications, if they affect your weight, they make people gain weight. Mm-hmm. So we use the side effect. Okay? Now, we don't know why people lose weight with Topamax. We know it's not an appetite suppressant like phentermine. Mm-hmm. It doesn't appear to affect metabolism. People just wind up eating less, and we don't really know what the reason is. The most serious side effect of Topamax is if a woman gets pregnant in the first trimester. There's a 20-fold increase in babies getting a condition called cleft palate. Okay. The other side effects of topiramate are really not that significant. They all go away if we stop the drug. It can cause some tingling in the hands. It sometimes will cause people to be a little disoriented. But in general, it's a pretty safe drug, and we've used it for many years, and we're very comfortable using it.
If you were to prescribe this and I were pregnant, but I wasn't in the first trimester anymore, would you prescribe it? Is it safe?
Yeah, as far as we know, topiramate's safe if you take it in the second or third trimester of pregnancy and didn't take it in the first trimester. Having said that, would I ever prescribe it to a woman who was pregnant in the second or third trimester? No, I wouldn't take that chance, and I think most doctors wouldn't do that either.
To see if these new medications are right for you, please contact our office at 708-383-5809 or our website, finegoldweightcontrol.com.